Khairy Jamaluddin is hopeful he will return to the Health Ministry after the general election so that he can complete some unfinished business. In an exclusive interview with FMT, the Health Minister said his main priority during his tenure was managing the COVID-19 pandemic. If reappointed, Khairy said he wants to focus more on solving long-term issues in the ministry.
Now, you have been highly commended for your achievements at MOH. What are your plans? So if your portfolio as the Health Minister continues after this, what are maybe some of the issues that you will continue to address and put on the table?
After I had managed to bring the pandemic under control, the focus was on longer-term issues at the Ministry of Health. And that had to do with making sure that we had enough doctors and specialists going into the future. There's still unfinished business there that I want to make sure gets done so that there are more permanent places for contract doctors, nurses, allied healthcare professionals as well.
Last year, a group of contract doctors held a nationwide protest demanding a fair career path and the same benefits as medical officers in permanent positions. Khairy also said he had to tie up some loose ends as far as the Health White Paper is concerned. The Health White Paper aims to tackle Malaysia's healthcare issues systematically by addressing the imbalance in resource allocation, organisation and policy focus between public, primary and secondary care.
That's my big dream of enhancing primary healthcare, making sure that the hospitals are well equipped, making sure that we have preventive strategies in place. Of course, the smoking generation bill that we need to bring back to Parliament to protect the future generation from cigarettes and from smoking.
Khairy, who is contesting in the Sungai Buloh seat, hoped that Ismail Sabri Yaakob would be re-elected as Prime Minister, giving him the opportunity to return as Health Minister again.
I hope if we win and Ismail Sabri is the Prime Minister by this time next week, he will send me back to the Health Ministry, at least for a bit, for me to put things in place and set the right course for the future of healthcare in Malaysia.
In October, Ismail said Khairy would be retained as the Health Minister, pointing out that it would be a loss if the latter was no longer at the helm of the ministry.